Welcome class 7 in our e-learning class. So today we will read from this chapter, role of the government in health, and in our previous live class we have already come to know about the story of this Ranjan and Aman, and also we have read about this Hakim Sheikh, and we were discussing on this topic public health services. Now we will resume reading. The health service is called public. Take out page number 24. Take out page number 24 of your social and political life to book 2. Yes, your civics book. The health service is called public for many reasons. In order to fulfill its commitment for providing health care to all citizens, the government has established these hospitals and health centers. Also, the resources needed to run these services are obtained from the money that we, the public, pay to the government as taxes. These things we have already discussed in our live class. Hence, such facilities are meant for everyone. One of the most important aspects of the public health system is that it is meant to provide quality healthcare services either free or at a low cost, so that even the poor can seek treatment. For this reasons only they go to the government hospitals, so that the treatment is done in somewhat at low cost or at free of cost. Another important, not only that reason, another important reason is also there. Just underline, I have said you on that day also to underline. Another important function of public health is to take action to prevent the spread of diseases such as TB, malaria, jaundice, cholera, diarrhea, chikungunya, etc. This has to be organized by the government with the participation of people, otherwise it is not effective. Not only government, it is our duty also to follow the instruction and take the safety measures, like for example as we are taking the safety measures just to stop the spreading of this COVID-19. For example, when taking up a campaign to see that the mosquitoes do not breed in water coolers, rooftops, etc. This has to be done for all houses in the area. Now, it is not possible for the government to just visit each and every house and check whether these things are maintained or not. It is the duty of that means it is our duty to check whether in my home I am maintaining all the safety measures just to stop the spreading of these contagious diseases. Recall the case of Hakim Sheikh. Would you like to know what the court said in this case? According to our constitution, it is the primary duty of the government to ensure the welfare of the people and provide health care facilities to all. So it is the primary duty of our government just to see that everybody, that all the citizens, all the people living in this country, they are getting proper healthcare facilities. The government must safeguard the right to life of every person. The court said that the difficulty that Hakim Sheikh had to face could have cost him his life. Yes, we have seen that the way he was just moving from one hospital to another one, moving from one hospital to another, while moving, at that time also he could have just died. But by God's grace, he was alive even when he was refused admission in all those 8 government hospitals. Just let me check once, 8 only, no, it was, wait students, yes, 8 different government hospitals. So what would have happened if on the way he would have died? So it was really at the risk of his life. If a hospital cannot provide timely medical treatment to a person, it means that this protection of life is not being given. The first hospital said that we are not having a spare bed. The second one said that specialized people are not there, specialized doctors are not here to treat you. So in this way, he was just refused admission. So what's the use of then having this sort of government hospitals? The court also said that it was the duty of the government to provide the necessary health services, including treatment in emergency situation. His was really an emergency matter, but he was not given anywhere the treatment. The treatment was not done. Hospitals and medical staff must fulfill their duty of providing the necessary treatment. Hakim Sheikh was denied treatment at various government hospitals. Therefore, the court asked the state government to give him the money that he had spent on his treatment. So, nice decision. It was taken by the court that the state government, it is the fault of the state government only. Why the hospitals are not having adequate system there? Why the government hospitals refused admission? Just think of the situation. If the patient would have died on the way, what would the government had done at that time? So now the court said that the government or the state government has to pay all the amount or the full amount that Hakim Sheikh had spent for his treatment in a private hospital. So children, in our next class we will proceed with the next part of this chapter, that is private health facilities. This one we will start reading in our next class. Till then, stay at home and enjoy reading civics. Bye.